Hi everybody, so this is Q&A Friday as promised, and this week we've gotten such amazing questions, so I'm going to try to call each one of you out. This first question comes from Kelly Evans, and I actually got this question from her through our YouTube channel. So she asks, "Hi, this is my question. I was diagnosed with lupus 5 years ago and I have a positive ANA test and constantly in pain. And from then there is times of pain so extreme that it literally causes me to break down and cry. I'm often on Prednisone, consistently been on Plaquenil, and now starting Benlysta infusions." She asks, "My questions are, do you think that these infusions are helpful for me as a lupus patient, and when I have my blood drawn every 6 weeks, there is some inflammation, but generally comes back normal for me, which makes me wonder if normal, why I'm diagnosed with lupus and taking medication. I hope that these questions make sense, and if you can give me any advice, that would be great. Thank you so much." Kelly Evans again. So let's first talk about Benlysta infusions. Benlysta infusions are specifically targeted towards the B cells of our immune system. Basically, without going into too much chemistry, it's to control the autoreactive, I don't want this to go out, autoreactive immune system. Sometimes we have fragmentations that occur when we've got some autoimmune activity within. And we need to clear the fragments of our own DNA out. Otherwise, we start to develop antibodies against that, right? So Benlysta is supposed to help with clearance of the B cells and its metabolites as a result of that kind of a cascade. But the thing is, I looked at the research a little bit more with a microscopic eye. And first off, full disclosure, after my third relapse with my kidney involvement, I wanted to get on Benlysta. It was offered to me by my rheumatologist, and I decided, yes, I wanted to do it. I wasn't in my best self at that time, but I've been on it for about 16 months now, and I'm talking about getting off of it because, one, it was offered to me by my nephrologist as well as my rheumatologist, and they both had a very intellectual talk with me about, okay, you've had 3 relapses with your kidneys, and so we want to keep you in remission forever and ever. This was strongly advocated, especially after I came out of my kidney nephritis so strong. They felt very strongly that at least I should give this a try, with an understanding that we'd be monitoring my lupus serology to make sure everything is good. So while I've been having good serology and it's almost very impeccable, so recently I went to my rheumatologist to discuss about me getting off of it because you guys know me, I don't like to take anything long term. I think for a short term, to recalibrate and to get my body in order, it's a good thing. But coming back to this question, I really wonder, Kelly, if one, when you say your normal inflammatory markers, is it just your, I'm assuming that it's just your ANA and maybe some SED rates and CRP levels are high is what your inflammation is. And when you say that the lupus panels or lupus are normal, then I'm assuming all your lupus serology is normal. So you really don't have antibodies. In which case, I would ask you, why are you on Plaquenil? Why are you on Prednisone? And why are you about to get on Benlysta? These are questions that I feel like you need to have. And you have the choice to say yay or nay to Benlysta infusions. I will tell you that when I looked at the research on Benlysta, I felt few things. There's been no long-term studies on what this is supposed to do. I felt a little bit of a lack in terms of how closely they monitored these patients with the subject base, and it wasn't a lot of diversity. And there's always, with the clinical trials, there's always, you risk the chance of it being not comprehensive in terms of your subjective pool, but consistently, they did show an improvement in the serology and kept them in remission longer than the placebo group. So that was positive for me. But at some point, you want to create a situation where if you can get off that prednisone by your diet and lifestyle alone, and I'm living proof that you can absolutely do that, but always be building this health alongside all your medical intervention, which might be creating more toxicity and unintended consequences that we don't normally know what that's going to entail. So that the choice is up to you. And you need to be asking your doctor why she feels like you should go on Benlysta. And I wouldn't go on it blindly, just to check and see if your serology looks great. So these are some questions that I had. If you wanted to clarify that with me, and then I can give you my input, not my opinion. This is something for you to weigh for yourself in ammunition against some of the things that are exposed or asked of you. So I hope that that helps. Okay. The second question comes from Cynthia Hildreth. She says, is there a sure thing as remission when it comes to lupus? And absolutely, Cynthia, that's all we're going for right now. There's absolutely a point where you can calm your lupus so much so that it never fires back up. It does take us to be very clear about what is required of us to get to that point, but that's what our Lupus Rebel group is all about, right? It's to strengthen you enough or strengthen your body so that it's capable of doing its own thing to make sure that you stay in remission forever and ever, and it's absolutely possible. Third question is, why are there so many different types of names for lupus? And this is asked by Veronica Thurston. So in medicine, as practitioners, we need a universal language to classify diseases so we have an understanding across the board, across any borders of countries, so that we can define and do more research. And so it's a good thing in many ways, but also it's also for us to be able to build different types of codes for our practices, and coding is necessary for us as practitioners to be reimbursed, right? Having said that, the International Classification of Disease, which is referred to as ICD, right? We went from ICD-9 recently to ICD-10. And let me tell you, it was a nightmare in my electronic medical record system because we had to update all these coding standards to the updated one. And we went from 120,000 diseases to 155,000 diseases. So we're naming more diseases to specify. So having said that, the reason why we have so many different names for lupus is that, I'm not sure if you're aware, systemic lupus erythematosus is SLE, and that's an umbrella term for everything related to lupus. However, that's typically when you say you have SLE, systemic lupus, that means you have some organ involvement. So they do have a term called cutaneous lupus, which is only for your skin. And then they have drug-induced lupus, neonatal lupus, and childhood lupus, and of course, discoid lupus. But overall, there's one name, which is lupus. Discoid is, something completely different. It's just erosional things and skin properties that kind of form very scarring-like things on the skin is called discoid because it looks like a discoid, like a lesion on your skin. But childhood lupus is nothing other than you had it, when you were a child, and neonatal is you had it when you entered, through your mother's vaginal canal. And that's usually because, the mother had some types of antibodies to make that happen, and then it went away. And then, of course, drug-induced lupus looks like something like lupus, but induced by the drug, so that when the drug is taken away, then lupus cleared. So that's how they kind of know. And so I know it's confusing, but when you say you have lupus, it's a general terminology. Now, I only had cutaneous lupus. Oops, my mic. I only had cutaneous lupus, which developed into more of an organ involvement after delivering my first baby. So I hope that that's clear. Another question that I have is, how does, this is an excellent question. I love this question. Thank you, Carla. Carla Teresa asks this question. How much does stress affect lupus and having a flare? And what are your recommendations for this? As most people have stress in their lives, what can we do? Great question. So stress is hard because stress is often not tangible. It's not something you walk around saying, but life is stressful. And we have levels of stress spikes and it dips, right? We've got some happy times intertwined with the low times. You might have gone through a divorce, your abusive relationship, or your son goes off and does something. It's everything related to life. It is stressful, right? But it's also important to remember our lives are not getting easier. So there was a study, sociological study, to indicate that with our smart devices in the workplace, we're expected to do a lot more. And so much more information coming at our way, we're having a difficult time filtering that information. So we get this concept of information overload, and it's causing digital dementias and Alzheimer's because we can't shift the thoughts. And this idea of multitasking is now being debunked, so much so that they're saying, you know, shut off your smart devices. And this can cause a lot of degeneration in our brain, and it can cause a lot of foggy brain, lack of focus, all those things that kind of collectively affect us as lupus patients. So I think it's a good idea to keep that in mind. And also, distractions will kind of deter us from keeping our focus, and lack of focus in what we're about to do. And every information that I share with you in terms of keeping a clean diet and, you know, exercising properly and all these things. But you and I both know there's a host of other practitioners saying probably the similar things that I am, but sometimes it can be contradictory, right? Sometimes it's autoimmune paleo. Some people are touting the keto. Some people are all about plant-based diets, and I don't know, any kind of diets there is. So key thing for you to understand is things about balance, right? Keep things in perspective. Always have a bird's eye view. So our autonomic nervous system, autonomic means it's out of our control. It has two different systems within it. One is sympathetic nervous system, and then the other one's parasympathetic nervous system. Sympathetic nervous system is a very healthy response. Our limbic brain, our primitive brain, that's our way of keeping ourselves free of harm. So in our hunter and gatherer's age, we used to fight for our food, and we used to run for our fear for our death, right, of threats to us, because there would be like big lions and tigers attacking. And so there's this like high for a moment to have that survival mode so that you can place all the energy into your muscles so you can run like crazy, right? Those are pretty good systems. And then we've got the parasympathetic nervous system, where it's all about calm and peace and breathing. It's sort of that state of complete rest, you know? But often, the reason why I said overreactive and overstimulated society creates a lot of sympathetic nervous system, because one, we have fears, fear of unknowns. And for us lupus patients, what that means is fear of life with lupus, we don't know what that's like. And so often we wake up day by day with different symptoms manifesting. Well, that creates a lot of fear in our bodies, right? And that fear has its own cascade of neurochemistry. It speaks to our gut, from our gut to our brain, and then it wreaks havoc in our hormonal system. It gets really, really deep. And that can throw us so much off kilter that the fight or flight is our baseline now. And so we're always hypersensitive, we're always vigilant, so much so that we become debilitated. And so that can cause a lot of inflammatory cytokines to be triggered so that it never shuts off. So how do you deal with that? A lot of gratitude journaling is a great way. I teach patients how to do heart math, coherence building techniques. It's a little device that you can buy, but you don't even have to go that far. You can get like a Calm app. It's a meditation guided imagery type of an app you can sort of implement wherever you are. Or just take 5 and just breathe and just tune into your body and get one with your physiology. When was the last time you spent 5 minutes by yourself asking yourself questions? When was the last time you spent 10 minutes sort of writing out what you're grateful for? Because if you're living in this country, in the United States, you have no idea how fortunate we are. We have so much, and sometimes, you know, too much abundance creates ungratefulness. Once we start to count how many things we're grateful for, the fact that you have a Facebook account watching me right now, this is all things. And then we have each other to kind of keep accountable accountable and to support, these are all things that we can be grateful for. Sometimes tuning into that and resetting our balance state to kind of bypass our limbic brain, which is a very primitive brain. And prefrontal cortex is that intellectual brain where we're able to think a little bit more analytically and to assess. But one thing I'll end with here is outside of this breathing technique and tuning in, doing some yoga and just really cultivating awareness for yourself, the thing is, when we do bypass all these analytical things, the choices we have to make, and I know this is where you guys are struggling, is the more I share about the foods, the more Dr. Axe autoimmune paleo protocols or anything else out there that are touting the best thing or any supplements, it's confusing your mind. And if there's too much coming at you, there's a limit to where your brain can function. And when your brain is too confused and you have information overload, what happens is that we also stimulate our sympathetic nervous system. And we're in this fight and flight mode. And you know what we end up doing? We end up doing nothing. It's called analysis paralysis, because you don't know what to do. You know so much, but you don't know how to step into it and put it into an actionable form. And so I'm going to try really hard in the coming months and coming weeks ahead to make sure I boil it down to simple steps. So then you don't have to ask so many questions, because wherever you are, it's the action that you take every day that's going to catapult you into the next action so that you can progress forward. Okay? So I hope that that helps. I think that's all I think I want to say. And once you have coherence in your body from your autonomic nervous system to sympathetic nervous system and you have a good balance there, guess what your body does? It gets busy healing and regenerating. And it's able to kind of balance and everything in your system, because the central nervous system is huge. And that's our central capability to modulate every little enzyme, every little hormone, every little anything at the cellular level in our body. So that's a very powerful question. Thank you so much for asking that, Carla. Next thing is, what is the connection between lupus and chronically inflamed tendons? What is the best way to deal with it? And this is asked by Anna Henderson. And again, it's such a great question. All right, so many of us have lupus, and many of us lupus patients have undiagnosed fibromyalgia. Fibromyalgia is nothing other than inflamed muscles and joints in our bodies, right? We have inflammatory cytokines, and really our autoimmune conditions are turned on by the underlying inflammation that never shut off. And so when we have an overactive inflammatory response, that's our immune response to try to kill the friend from foe, it starts to mistakenly, as it gets tired, it starts to develop an adaptive strategy to start to kill itself, and it's confused and it's slurred and it's, lacking sleep, so it's tired. And so that's when we start to develop these autoimmune antibodies. And that's a state where we find ourselves. And so the key thing is to decrease, I'm sorry, I did something here. To decrease the inflammation in our body. So, when our enemy enters, our immune system attacks, and we all felt the physiological effects of this. We have fever, we have swelling, we have redness, we have loss of function, right? And that's the immune response, and that's a very healthy response. But over time, that should be dialed down, but our body never dials it down. So it gets into our musculoskeletal system. So now we have a very systemic aches and pains. And it's that feeling that we get sometimes when we wake up and we feel like we've been beat down or run over by a truck, and you're like left to kind of move, but sometimes you just wake up so stiff and so much in pain. That's when you're inflamed. And so I really feel like if you can move your muscles despite the pain and just flush them out. I've shared a lot of videos with you with the yoga, and the more we can kind of enhance flexibility and balance that with stability and allow our muscles to pump through incorporating our breathing techniques to flush out the toxins, it allows more of our body to start to be metabolically efficient. And that's what you want, so that we can flush out all the inflammatory cytokines. That along with drinking lots of water and keeping us hydrated, simple things like making sure you're getting enough sleep, and sometimes massages help, help to do this too. And you can, like I said, you can meditate and eat a healthy plant-based diet with protein and good amounts of fat, and just not too much. Everything is about balance. I hope that helps to answer that question. It all comes down to the underlying root cause, and so we always want to be looking down below. So this next question I love so much, and it was a very highly intelligent question, comes from a very intelligent woman. Her name is Pamela Jean Kirsten D. Aquar Lascol. Hi, Pamela. Thank you so much for such a great question. It's going to be a mouthful for me to read this question. But I feel like it can benefit a lot of you. So here it goes. I feel lupus is a hormonally driven illness. I came down with lupus at the age of 12, and I had just started my menstrual period. As it had been well documented, most patients receive the diagnosis of this disease during the ages of puberty and the ages of childbearing years. There's also been much discussion of how menopause and your menstrual cycle itself affects disease activity and flares. Most women experience symptoms of lupus flare prior to starting their period, while a great percentage of women claim to have less disease activity once they have started and are going through the process of menopause. The last 10 years, I have been in a state of major disease activity. I am 100% sure what put me there. I went through a very rigorous fertility treatment plan preparing me for egg retrieval so that my cousin could be my surrogate. On these drugs, and my body reacted horribly. As a result, the doctor handling my case canceled without any discussion with my husband and myself the egg retrieval 2 days before due, leaving us childless today, out $12,000, and so sick my entire life has changed permanently. Oh my goodness. I know there are many factors that play a role in autoimmune diseases. Clearly, there is a connection between hormonal and environmental conditions with lupus. We have treatments for other hormonally related diseases like diabetes and thyroid conditions, both of which I have a connection with. I believe have a connection with what we put into our bodies, and yet so many patients seem to get their backs up when you start talking to them about nutrition in the way of treating disease. I feel that because this disease is so big and attacks so violently, so many different parts of the body, we're then looking for answer that is as big as the problem. And when you stop and think about it, just as putting gas in an automobile to make it run properly, doesn't everyone's whole health center around the food and nutrition we put into it in the same? What are your thoughts on the subject matter? I couldn't agree with you more. But kind of going back to how your hormonal treatments kind of catapulted into all this, and I think there's several things. At that time, I think it was a very highly stressful situation. I've had friends that went through the whole process. It's a nerve-wracking, up and down, ebb and flow. It's just a very ugly way of getting your baby, getting all that injection. And to have that hope just be completely taken out of you, not to mention the finances, I think that stress in itself put you in this hyper state, sympathetic, like fight or flight mode, no doubt. And I think that coupled with everything else sort of kind of cascaded, like blew everything apart, right? To kind of put you in this sick state. So, having said that, yes, in the functional medicine world that I'm in, we do believe that there is a connection with lupus and hormones, definitively. I too have had extensive hormone testing, to let you know, and I wanted to make sure that everything was in right order. But here's my thoughts. Due to the underlying inflammation, which can alter the homeostasis of our body, it's hard to place a finger on exactly what triggered the lupus, right? And that's a fact. We can sit here, have a conversation about what might have been all day long, but there's so many things. There's a huge genetic disposition and, of course, environmental factors, and then the lifestyle things that we're perpetually doing to ourselves, right? There's a lot of variables to be considered. So homeostasis of our body is nothing more than our body in balance, and when skewed, we all respond differently due to our genetics, environments, and lifestyles. And the thing of it with is the medical system typically gives us toxic meds to control our symptoms. Our crazy immune system that's broken, right? And we tend to be overly burdened with toxins, which then like to reside in our fat cells. Now, those fat cells harbor a lot of toxins, and those fat cells now become our secondary endocrine system, which then affects our endocrine system. I call it the endocrine disruptors. So we add another layer of dysfunction and lack of homeostasis. And you had mentioned that that there was treatments for diabetes and thyroid, but those treatments are injecting more insulin and then giving you metformin. But those are just adding fuel to the fire because they have a secondary burden. Same thing with thyroid. So there's a whole hormonal HPA axis that I'll discuss later on. But right now it's the inflammation that's driving everything. And while thyroid and insulin are a factor and you think that we have a solution for that, we really don't. We don't have a control over diabetes. We don't have a control over thyroid. So the last thing I want you to consider is looking to hormones and to be injected or taking it orally. Rather, I want you to focus on first thing foremost. Before we jump the gun, we always want to do things on the fundamental levels. That's to clean out our eating habits, right? One other thing that I want to mention is most of us lupus patients, because of the underlying inflammation, we do have insulin resistance. We have glucose intolerance. We have a receptor issue. We have a mitochondrial dysfunction. All these to say is that we've got a real problem underlying. So, point is to pull out and really get an overview of what's going on in your body and think about what the root causes might be rather than getting lost in the science of little dysfunctions, getting a microscopic view, because that's what our doctors are really, really excellent at, looking at the pathology, and looking at that pathology to kind of do away with the inflammatory pathway. And it's a specific pathway. When they block it, the symptoms disappear, but then they have secondary symptoms that appear over here. And so we really need to draw out and look at the whole system to really understand what this all entails. But I have no doubt in my mind that if you do heal your gut, and that's where you begin, you can not only modulate your hormones, your inflammatory cytokines, clear your brain, and really, really fix your microbiome in a way that's going to be friendly and more beneficial for you. I've got different programs. I've got a free elimination diet guide here in our group under files, and you can go and get that. A lot of the times that can be overwhelming, so we have a really detailed guide that I produced, a PDF format, and then as well as we have all 9 step-by-step almost a course that I created over a 5-week period to address all these matters, and you can buy all that at lupuspharmacy.com. And then there's some supplements that we can incorporate into your protocol to help you if you so wanted to. So I'm going to end with that and move on to the next question. Next question is, I keep getting reoccurring bladder and chest infections and went to the natural health store for some support. They sold me an immune boosting supplement, but when I got home, I was too scared to take it, as I have read that anything that boosts the immune system can trigger lupus flares and should be avoided. Are immune boosting supplements safe for those with lupus? Can you please explain why or why not? Thank you. Jennifer, Poland. Thank you, Jennifer. We've been talking back and forth via email, and so I'm so glad you asked this question. It's a very good question. I would, for now, hold off on any immune boosting supplements because really, they don't know, right? What we have is an immune compromise, not so much it's an immune boosted, like overpowered. Yes, it's on hyperactivity, but it's doing that at the risk of putting our immune defenses down, meaning it's almost an immune deficiency. Okay, so we have to be very careful of the supplements that we take. Is one of the reasons why I took it upon myself to have the solid fundamental supplements available for you at lupuspharmacy.com. It's something that we have to be very, very careful not to trigger our immune system in any way. Immune boosting is not a bad thing, but immune boosting supplements, I would really wonder what it's comprised of. So on the topic of immune boosting, you've heard me talk about leaky gut, right? Leaky gut is nothing more than gut permeability. We've got a lot of toxin entering our system. How we block that at the first line of defense is consider taking a very diverse strain of probiotics. And then you want to feed it with prebiotics by eating lots of fruits and vegetables. Okay, basically you're taking probiotics with the elimination diet high in fiber and fruits and vegetables, colorful vegetables. That's probably the best thing that you can do, because our bodies are like in our gut, it's on our skin, it's on everything. It's in our nose, it's in our mouth, it's in our gut, it's in our vagina, your rectum, anywhere on our body. We have fungus, we have parasites, we've got yeast, we've got bacteria, and we've got viral infections happening all the time. So the fact that you have these chest infections and reoccurring bladder infections is because your microbiome is compromised. Because that's a big part of our immune system, over 70%. So think about not really boosting it, but really changing the ecological health of your own flora so that you can really colonize really good, friendly bacteria to help you fend that off. Once that's changed, your UTI will substantially lower. Your digestive properties will be so much better. You'll no longer have leaky gut, but you'll be able to absorb a lot better, really by boosting your immune system as a secondary effect of that. So really, first things foremost, right? Just because you have infections, people are quick to sell you stuff. So I would be very leery of people selling you stuff unless you really trust them. You have no doubt in your mind. I mean, by all means, there's some good companies out there. I'm not saying mine's the best, but at least I know this is what I trust myself with. And because of my license and everything else, I would never give you guys anything else. And so again, these supplement companies will try to market to us who are looking for some help. And this is where I get a little protective over you to make sure we're getting the right things, because I've done the research and that's why I'm sharing what I'm sharing. So I hope that helps. Go with the probiotics. That's the best thing you can do to boost your immune system to prevent the frequency of these infections that occur. Okay? That's first and foremost. Number 8, I was just diagnosed a week ago with lupus. I have not started any medical treatment yet. It's my guess that I have had lupus for about 20 years, but no one can diagnose it. Along with lupus, I've been on pain management for bulging discs in my neck, arthritis, disc issues in my back, carpal tunnel. Will my rheumatologist be able to also be my pain management doctor and prescribe pain meds? Also, does each person have a different form of lupus? I know my doctor mentioned my kidney results were high. Does that mean my lupus affects my kidneys? This is asked by Lori Koss. Thank you, Lori. Welcome to the club. I know it's not the kind of club that you want to sign up for, but you're here and we can help. So welcome. I've been a physical therapist for over 19 years, and really I've co-treated a lot with my physiatrist colleagues on people with chronic pain, and we get addicted. We get addicted on opioids, and there's a lot of controversy around opioids right now, but a lot of pain medications, and it does have a lot of addictive properties. There's a lot of black market within our medical realm too. A lot of my medical doctors are very eerie of patients who are drug pushers or drug seekers. And so there's a little bit of a stigma around that. So be careful. I think your rheumatologist will be able to manage the pain by giving you some immunomodulating things specific to your lupus. But I wonder if you feel like you've had this for a very long time, like over 20 years, and you've been in a lot of pain. Again, pain is nothing other than inflammation gone awry, right? So it's the systemic inflammation. Do you have fibromyalgia? You have multiple inflammatory cytokines in your system, and you've been using such pain medications for a while, I'm assuming, to manage your pain, but it also alters so much your biophysiology and biochemistry, and most importantly, it's going to alter your microbiome inside. So much so that now you're going to have different issues. So Lupus is different for everybody. And so I can tell you it's going to manifest differently for you, and it's going to manifest differently. Now, is it a different lupus? No, lupus is just a name for a lot of the conditions, but lupus is just nothing more than our immune system gone crazy, right? That's lupus. It can affect potentially every organ in our body by causing itises, right? It can cause inflammation of your lungs, of your heart, of your kidneys, you name it. If your biomarkers are a little bit higher in your kidneys, I would suspect that you might have a higher double-stranded DNA along with some protein that they found in your urine, perhaps. But I don't know what they all checked, so I couldn't tell you what that looks like. But, you know, I think your rheumatologist will not touch your pain medication. They'll give you lupus medication. This is where I get a little bit concerned. This is the whole medical system for you, right? You have pain management doctor managing your pain for your musculoskeletal pain because now you've become a chronic pain patient, so they don't know what to do with you. They send you to pain management group, which, you know, they kind of alter what pain medications you're going to be on. And they're scrutinized big time because it's highly toxic, it's highly addictive, and they have a lot of abuse, you know, with these kind of substances. And then you've got the rheumatologist now to add to your list to go see for your autoimmune condition. And then you've probably gone to see your orthopod and probably a physical therapist and your internal medicine. And so you're going to get a growing list of medications here. But if you really wanted to get well, I would really, really be careful of adding any more medications. Really talk to your rheumatologist and see if she supports you in the way you should be eating and you should be moving and sleeping and drinking water. These are some foundational things that you need to be doing to boost your body so that you can come out on top. Because with all these medications, I can tell you, it's not going to look good because you're taxing your liver. You're going to tax your kidneys. You're totally skewing your body's ability or destroying your body's ability to detox properly because you've got now a concoction of toxic burden in your body trying to make sense of it. And remember the earlier question about the drug-induced lupus. There's a lot to be said about foreign substances like medications that sometimes we take it and our body just doesn't know what to do with it. Hence the term toxins. Not to mention we have gut permeability, hence the term leaky gut, which doesn't allow for differentiation to block it off. So microbiome is huge, so probiotics, prebiotics through vegetables, and taking these supplements is absolutely key. I mean, initially in you really combating what you need to be doing. So please put the feed, and I'll be glad to recommend the best probiotics that are in my opinion. You can pretty much get any probiotics pretty much anywhere, Amazon, name it, whatever. But I wouldn't recommend what I wouldn't take, and I wouldn't take those supplements, you know, if you gave it to me free. I've taken it away from my patients. So that's my question. I'm going to end on that. I hope that that helps. So the last question is it true that the lowest prednisone dose in an individual can be on is 4 milligrams a day? I've asked my roomie to put me on 4 milligrams to 3 milligrams alternating days. I'm trying to get down to the lowest dose possible with the lowest possible side effects since I've been on the drug for 7 years. Now with Prolia for 2 years, I'd like to build up my bone strength again, which prednisone made brittle. It's by Maria Olson. Maria, thank you so much for this question. So I want to start out by saying medications have unintended consequences. And in my discussions with my rheumatologist, 7.5 milligrams of prednisone is considered physiologic, right? That's how much your adrenals would make cortisone. But long-term, use in any way is linked to too many side effects, and it's pretty scary in my opinion. So let's first discuss how corticosteroids work. So steroids are a group of biochemicals that make up the hormones in your body. Of these steroids, cortisone is a close relative of cortisol, which is produced by your adrenal gland. And this is your basic physiology, right? And cortisol is supposed to be a natural anti-inflammatory hormone in your body. And so synthetic cortisol medications like corticosteroids, also known as prednisone, are some of the most effective and sometimes the only treatment for suppressing our immune system specific to lupus. So they're very effective at reducing the inflammation like swelling, warmth, pain, tenderness that are associated with lupus. So having said that, due to the unintended side effects that can potentially be dangerous, it's really in our best interest to resort to that as our last source. And I think most great rheumatologists kind of have that understanding, so they're quick to put you on it, but quick to pull you out of it too. So please talk to your rheumatologist for that. So the answer of 4 milligrams to 3 milligrams, if you're taking that little, I would ask, maybe taper down even further and see if your adrenals kick in. I know it's a very hard thing to kind of risk, provided that you have these flares, but how about if you do that by building your gut and getting a good dose of probiotics and making sure that you're on an elimination diet pathway to help yourself in any way and hydrating really well, not exercising to the point of catabolism, which is breaking down of your bones or your muscles as you work out. I wonder where that would go, because I took that risk and I've been off of it for a long time. And yes, I did it with reluctance from my rheumatologist, but she's amazing. She's worked with me to make that happen. So I want to kind of tell you that with the name of managing disease, we often create another dysfunction or another disease. So you really have to just be careful of the long-term consequences of this. So your last question about osteoporosis. My mom has osteoporosis. She's tiny like me, and it runs in my family, not to mention the multiple high dose of prednisone usage has put me in a state of osteopenia. We're monitoring that, but I'm very vigilant about keeping it status quo so that I don't get into that window of osteoporosis, because I don't want those medications. It's got, again, unintended side effects. So I have a great supplement that I placed myself on, as well as the patients that I treat that have osteoporosis, and it's been great. It's kind of proven itself through the clinical trials that I looked at, and it's working for me great. And it's not just about the calcium, but it's about calcium, magnesium, and potassium, and all the building blocks for the bone that's in this proprietary blend. So if you're interested, please ask me in this feed and I will hook you up. So thank you so much for allowing me to participate in this Q&A. I hope this is helpful. Those of you who are curious about where to find me is lupusrebel.com. I have a podcast that I recently started, so I would love for you to subscribe. You can find me there on connie.com/podcast/, and we have episodes uploaded there, and this Q&A will be available there as well. If you would please subscribe to my YouTube channel. We kind of share all this media and everything that we do through videos, through YouTube, through our email lists, so please join. And of course my center website, alkalinewellness.com. So these are some ways to find me. We also have a private Lupus Rebel group, so find me there. And then also I have a Lupus Rebel page. So I hope that this helps, and I'll talk to you next week.